Hello. A 16-year-old female enters my OPD with ultrasound findings of polycystic ovaries and asks me to give treatment for PCOD. My first question is whether by just ultrasound findings can I label someone to have PCOD? The answer is no. To label someone to have this syndrome complex, one should fulfill at least 2 out of 3 criteria. That is, she should either have oligo or anovulation in the form of menstrual irregularities or infertility. She should have signs and symptoms of hyperandrogenism, or lab findings should suggest hypertestosteronism, and ultrasound should show polycystic ovaries with or without raised AMH. So, at least 2 out of these 3 Rotterdam criteria should be present. This is a syndrome complex having many of the manifestations like endocrinal, metabolic, ovarian, psychological and dermatological findings. That is why this syndrome has been renamed as polyendocrine metabolic ovarian syndrome. The patient suffering from Pmos has menstrual irregularities, hyperinsulinemia, hyperandrogenism, and she is either obese or can have fatty liver, and she can be suffering from hypertension, hyperglycemia, psychological symptoms in the form of depression, stress, anxiety, and suicidal tendencies, dermatological findings in the form of acanthosis nigrans, acne, and hirsutism or excessive hair, and also she has lack of interest in her activities. So, since this is a genetic disease and India is a diabetic capital, so incidence of PCOD or Pmos is rising in India. The first and foremost treatment protocol is lifestyle modification. Dietary changes, exercise, yoga, meditation, and her routine lifestyle can impact this disease, and many of the problems can be solved with just 5 to 10% of weight loss. The medical treatment comes after that and is targeted according to the lab findings and the signs and symptoms of the patient. So, lifestyle is the most important part of Pmos. Thank you.